to you later this week. I will now pass over to my colleague Anne McIntosh to begin the session. Next slide, please, Stephen.
Thanks, Katrina. Hi, everyone, and welcome to the webinar. Again, if I can just reiterate what Katrina said, and thank you all for coming along and giving up an hour in the sunshine, because you always worry that it will be the last hour of summer that you're missing. My name is Anne McIntosh, and you've already met my colleague Katrina Kennedy. We're both inspectors of early years. Joining us is Senior Improvement Advisor for Infection Prevention and Control, Jackie Dennis, and she's here to assist with any infection prevention and control questions that you may have. We also have team managers Lisa Kirkbride and Karen Quinn with us, who will monitor the chat and contribute to any questions you may have at the end. So we'll go straight into it. The session is aimed at all registered childminders, and the objectives of the session are to share the findings with you from key question 5 inspections that were carried out between October 2020 and June 2021. We'll signpost you to some good practice guidance to help you improve outcomes for children, and we hope to give you some key take-home messages. So we've analysed the latest requirements that were made during inspections, and we wanted to share that learning with you to help you to develop your service. The aim of this session is to be helpful and informative. We know that people are tired and have had a tough 18 months or so. So it's important at this point, we would like to take the opportunity to express our thanks for all the hard work that you've been carrying out and continue to do so each and every day. We know it's been a tough time. Next slide, please, Stephen. There are around 4,200 registered childminding services, and you're caring for a total of 26,500 children. During the period October 2020 and June 2021, we inspected 115 childminding services and we made 30 requirements. The important thing to mention here is that most services were evaluated as good or better. You're doing a good job. However, this session is about highlighting and sharing with you the trends where requirements for improvement were identified. Hopefully, by informing you of the common issues, you can use these to reflect on your own service. While we've moved from key question 5 inspections back to themed inspections, we will still assess infection prevention and control to support children's health and well-being under the quality theme for care and support. It's important to remember that Covid-19 has not gone away and we need to learn to live with it. You will have seen in the news this week that cases are on the rise. We need to ensure that we can respond to the community outbreaks of the virus and local protection levels if these are reintroduced by the government at any time. Throughout this session, we'll talk through the main areas and give you helpful guidance and reminders. Now we will look at the key areas in more context in the next slide. If you could change the slide, please, Stephen. The pie chart that you see there highlights the common issues that were found during inspections. The largest inspection shows that over half the requirements we made were due to a lack of general knowledge and understanding of the Covid-19 guidance, and we'll talk about that in a bit more detail later. Within the knowledge and understanding of Covid-19 guidance, infection prevention and control requirements were most commonly made, and these included concerns around hand washing, incorrect use of PPE, inappropriate use of alcohol-based hand rub, not having risk assessments in place, not following appropriate procedures when children displayed symptoms, and not having enhanced cleaning procedures in place. The next section of the pie chart relates to personal plans. Again, we will go into this in more detail further in the session. Then we have notifications, policies and procedures, and risk assessments, which we generally call quality assurance. And although not big enough to feature on the pie chart, we will also highlight some of the child protection information today. If we could have the next slide, please, Stephen. So what resources are available to help you with the top areas for improvement? Well, we launched Key Question 5 self-evaluation document, and we ran bite-sized sessions to support self-evaluation of your service. These are still available on our website and they're well worth a look. They only last a few minutes, which is absolutely perfect for my level of concentration. We created and continue to send out provider updates, and we will tell you how to sign up for them at the end of the presentation in case you don't know. We delivered Covid-19 webinars in partnership with colleagues from public health, and we shared lived experiences of children, staff and providers of services, including the experience of a childminder during Covid. We developed frequently asked questions and created a compendium of Covid-19 best practice guidance, which we'll signpost you to. Inspectors increased support calls to childminders during the pandemic if they were open. But we would like to remind you that your inspector is still there to help, so please reach out and make contact if you need any advice. Next slide, please, Stephen. So our first signpost to good practice is the Scottish Government Covid-19 data site. These links on the slide will allow you to see transmission rates by age group and local authority. You should access this information regularly to keep yourself informed of the transmission rates and protection levels in your local area and to help you to respond to these. The Scottish Government have been clear that the protection levels can move up and down as we navigate our way through this pandemic. This was mentioned just this week on the news by Nicola Sturgeon. The updated guidance for early years in relation to Covid-19 indicates that you may need to adjust your policies, procedures and risk assessments as and when the protection levels change. And you may need to think about other areas other than the one that you live in, for example, if you have families travelling in from different areas or if you want to go on a trip. So you may want to consider this in your risk assessment if you're taking children out with your local authority. Next, we will take each common area from the pie chart and signpost you to the good practice guidance. Can we please stress again, Covid-19 is still out there and we have to be mindful of that as we move to our new normal. Next slide, please, Stephen. So the first guidance we would signpost you to is the Scottish Government Guidance for Childminders, which can be accessed online. Check this guidance regularly because it changes. It's not worth printing the document because if it changes so often, but if you really like a paper copy, you will need to check that you have the latest version. So if you see the publication date, it's usually in the top left-hand side, or last updated date has changed, then there's something that you need to be aware of. Inspections have highlighted the need for childminders to be aware of this guidance and to follow it. Some requirements were made due to the lack of general knowledge and understanding of Covid-19 guidance, as we said. This included trips and travel guidance, keeping accurate records of attendance, and knowledge of Covid guidance in general. If we can go to the next slide, please, Stephen. Within the knowledge and understanding requirements that were made, infection prevention and control featured highly. The infection prevention and control and space to grow documents that you can see on the slide are helpful and relevant pieces of information. We recognise that the infection prevention and control in daycare setting document has not been reviewed and updated in a while, and we've highlighted this to the Scottish Government, so hopefully we'll see this updated in due course. So we made requirements based on hand washing. Alcohol-based hand rub is discouraged for use for children under 5 years unless there is no other option. It should not be used at all for children under the age of 1. Health Protection Scotland guidance on infection prevention control in childminding settings advises that if there is no running water, hand wipes can be used. If wipes are being used in situations where running water is not available, it's recommended that hands are washed with soap and water at the earliest opportunity. A hygienic environment and enhanced cleaning has been a required improvement in some settings. Most often we've observed that cleaning touch points such as door handles and light switches had not been carried out, so particular attention should be paid to cleaning the likes of tabletops, chairs, doors, light switches, banisters, toys, equipment, sinks and toilets more regularly. We would like to highlight you to the appendices in the Infection Prevention and Control document. They are useful as they include exclusion criteria for infectious diseases, a helpful checklist in the case of an outbreak, and a poster on effective hand washing. Appendix 10 also contains guidance on how to keep toys and equipment clean. We'd also like to remind you that there's helpful information and resources found in the Space to Grow document, and section 2 of that document highlights the importance of a clean and hygienic environment. Next slide, please, Stephen. So this is about Key Question 5. While we are no longer carrying out dedicated Key Question 5 inspections, it will still be considered within our themed inspection under care and support, and we will continue to signpost you to this self-evaluation document. Key Question 5 will help you to self-evaluate and consider how you will maintain COVID-safe practices. By now you should be familiar with this document and how it affects your practice. It is designed to help reassure you of the things that you're already doing to keep children safe and help you see any gaps that you may not have considered. You will want to return to this and update it as we learn more about living and working with COVID-19 in our lives. And as I mentioned before, there is useful bite-sized resources on our website to support your self-evaluation using Key Question 5. I'll now hand you over to Katrina to continue with the next session. If you could change the slide, please, Stephen.
Hi there. The second most common issue found during inspection was to do with children's personal plans. The personal plan legislation requires childminders to create a written plan in consultation with the child and, where appropriate, the parent. In childminding services, it's always appropriate to consult with the parents. The plan should detail how the child's health, safety and welfare needs will be met. When updating personal plans, we found some childminders were not considering children who may be more vulnerable to COVID-19 due to health reasons. These children will need an individual health risk assessment. This is something to create with parents to show what measures you will put in place to keep their child safe and healthy. Guidance can be found under operating conditions within the Scottish Government Childminding COVID-19 guidance. If children have been off, you need to go back and check their information. One example of an issue we found was when a child started toilet training at home while the service was closed, and due to the personal plan not being updated with the parent, the childminder was unaware of the signals that the child used to indicate that they needed the toilet, and as a result, the child had more toileting accidents, which raised their anxiety levels and pushed their progress back. This is an example of why reviewing personal plans is key and why reviews sometimes have to be carried out sooner than the 6-month recommended period. Can we move to the next slide, Stephen? Children who are known to us as vulnerable may be more at risk when they have to spend longer at home. Do you know if children in your care are on the Child Protection Register or in kinship care or foster care? Have you asked? It is perfectly acceptable to ask these questions. You need to know about every new child as part of their personal plan when they start with you. If your childminding service needs to close due to an outbreak, you should tell the child's social worker or health visitor if you have concerns. We found that some childminders had not considered the impact of children not attending their service and how this could potentially leave children more vulnerable. Can we have the next slide, please, Stephen? Risk assessments are expected to consider all risks in respect of COVID-19 and must take account of all relevant guidance. A risk assessment, and it's not a bad word, we're very keen that you embrace the risk assessment love. A risk assessment should be a working document. We don't mind how they look. They need to be on paper. They might be on paper or digital, but they must be recorded. However you have recorded them, it is very important that they contain relevant information for you, the children in your care, and their parents. You should work in line with what you set out in your risk assessment. Don't be afraid to mark on it and change things as guidance changes, or if you find a better way to do something. It's your document, it belongs to you. The assessment should be revisited as things change in your setting and guidance is updated. It should clearly identify risks and mitigations and any control measures you've put in place to reduce risks wherever possible. You must share these risk assessments with any assistants, any parents and children where appropriate. Your risk assessments must reflect the risks within your own service. As we all know, one size does not fit all. Your risk assessment is unique to your childminding service. It's okay to download a generic risk assessment document to give you an idea of how to complete a risk assessment, but you should personalise it to your own service. You must take account of your own home, garden, frequently visited play parks, and any individual children's needs when you're writing them. Ask yourself, what would inform your risk assessments? How would you respond if your local area were to go up or down in a protection level? And we're hearing on the news that this is potentially going to be an option. So we are going to push that a bit. The other question to ask yourself is, are you checking Scottish Government, Care Inspectorate, Health Protection Scotland and Health and Safety Executive sites? The Scottish Government guidance that we highlighted earlier sets out good advice for risk assessments throughout the whole document. So have a wee look back at it. Could we have the next slide, please, Stephen? Having an outbreak of COVID can be a very worrying time for you, and we realise that you will have a lot going on at that point. Your inspector may call you when this happens. This is to offer you support, so don't be alarmed if you receive a call. It doesn't mean that you have done anything wrong. Sometimes we're not notified through e-forms of suspected or confirmed outbreaks, and quite often people forget to tell us about the end of a suspected or confirmed outbreak. Notifications can be accessed through your e-forms. The COVID-19 notification the Care Inspectorate need are a notification with regards to a suspected outbreak of COVID-19, a confirmed outbreak of COVID-19. We also need the notification for the end of a suspected outbreak and the end of a confirmed case. Changes to service delivery due to COVID-19 is another notification that's needed. This is needed at the start of and closure, and again at the start of a closure, and again when you reopen your service. Next slide, please, Stephen. Additional guidance to support your setting. We would like to remind you that about our provider updates. To sign up for them, you can do this on our website. If you haven't been receiving the provider updates recently, please go back to the Care Inspectorate website and re-sign up. We were aware at Christmas there was a wee change to them, so if you hadn't been receiving them, you needed to go back in and re-sign up. In addition to the guidance we've already mentioned in the previous slides, the slides that follow will show you where to access additional information you may need. Could we have the next slide, please? Frequently asked questions will remain on the Care Inspectorate website for now. We have updated them this week. Our aim is to continue to update them every 2 to 3 weeks until they are no longer needed, and I have my fingers crossed. If there are major changes to guidance, updates can take us longer, so please bear with us. Could we have the next slide, please? The Compendium is a quick way to access relevant guidance. It is divided into sections based on specialism. Please scroll down until you find the ELC section in section 4, which includes guidance relevant to you all as childminders. The compendium will remain in place on our website. So the compendium is on our website. You can access it. Next slide, please. The Parent Club is a Scottish Government website and is a good source of information for parents. We have found it can also be a very useful source of information for childminders. Next slide, please, Stephen. We are sure many of you will be totally familiar with the Scottish Childminding Association, also known as SCMA. The website has COVID information and frequently asked questions sections you may find useful. Next slide, please. We are aware of how difficult it was to navigate the general public travel guidance alongside the childminder COVID-19 guidance, especially at the start of the pandemic. We were there with you. Thankfully, things have calmed down now and restrictions have eased considerably. We wanted to highlight the physical distancing section of the Childminding Scottish Government guidance, as it includes information about trips outside the childminding setting. It states trips outside the home are permissible and encouraged, providing they are in line with the latest general public guidance on physical distancing and travelling distances. You can find this section by scrolling down the guidance, Scottish Government guidance, to the bottom of the physical distancing measures page. There are links there to guidance on physical distancing, exercise and activities, and social meeting guidance. Please keep in mind that moving forward, trips may also be dependent on the local protection level of your area and the area of your destination. Next slide, please. Anne and Jackie have been monitoring the chat. We will now have a short question and answer section. Any questions not answered will be typed up and sent out in the next few days. Anne, are there any questions that we can answer now, or would be helpful to share with the wider group?
Yeah, so we've had a couple of questions about under fives not requiring PCR tests. One is concerned about allowing a child into your home when one of their family members has tested positive, and another is asking if children can be tested if their parents want this. So firstly, what I would say is we understand that the relaxation of the self-isolation rules and testing guidance can be worrying. There is a big change in that. However, the Scottish Government have based their decision on the updated understanding of transmission. So the scientific data suggests that there is little evidence that the child will transmit the virus to adults, and that's what the Scottish Government have based their decision on. To address the second point, children can be tested if the parents wish to do so. Although testing is not required, it should still be encouraged. The Scottish Government just recognise that this testing is invasive and can be distressing for young children. We will signpost you to the Government statement in relation to self-isolation when we send out a copy of the questions and answers.
I also note that there is a question which please clarify why we must close if someone in our family has COVID-19, even if they can self-isolate away from our setting. Again, the Scottish Government position on this is that you should not operate your childminding service where COVID is present. It's against public health guidance for an ill person to move to another address to self-isolate. So that's why the Scottish Government have put in a position statement that childminders, if there's a member of your own family testing positive and has to isolate, that you have to close your childminding service. Okay.
There's another question here, Katrina, about maths. Can we stop wearing math at drop-off and pick-up if done at the door? So if you cannot maintain a physical distance of at least 1 metre, then face coverings should still be worn. So that is going to depend on the age of the child being handed over, whether that can be done from the required distance. And also thinking about having a face covering handy if a parent decides that they want to have a chat and stay around a bit longer. There's another question for you there, Katrina.
There is. It's with regards to children under 3. When doing observations and reviews, do we refer to curriculum for excellence alongside the Shinari indicators? Again, not quite COVID related, but we'll answer it. The curriculum for excellence is for children aged 3 to 18, so no, you would not need to refer to it. The Shinari indicators or wellbeing indicators are a useful tool to assess and discuss how a child or young person is doing at a point in time, and if there is a need for support and what support to get. They can be helpful when completing the child's plan. They allow you to draw on the child's strengths, consider what support is needed and how you're going to do that. These can be used by an organisation such as the NHS or a local authority, or when services need to work together, for example, to coordinate a children's plan.
Okay, and we've got another inquiry. Please bear with me because it's a bit complicated. It's about the registration. So according to Care Inspectorate regulation, childminders can care for a certain amount of preschool children and a certain amount of school-aged children at any one time. The question is about funded places. So it's about the time that children are then considered of a school age. So we do not have any influence over funding arrangements. That would need to be taken up with the local authority. Okay, and that is the questions that were pre-populated, but I'm just going to check the chat for anything else, and feel free to add anything.
Yeah,
and we will try and get to them.
We have one question which I think we've answered, Gillian Hamilton. Are masks still a requirement during drop-off and pick-up if the child willingly walks from and to the person leaving and collecting them? I think we've answered your question there, Gillian, which is it's about physical distancing. Masks need to be worn if you can't physical distance from another adult. And I think there's one there. Why have some childminders had phone calls through this, but some childminders have had no phone calls? I'll answer that. It's been a case of we've tried to do our best to get in touch with most people, but some people haven't been in, or some childminders haven't needed required phone calls. If you've needed something, we've been very open and honest about coming. Give us a shout. Lots of childminders have phoned and asked questions as we've gone along. If you've needed support, please, we're here. Give us a shout.
The other thing to add to that, Katrina, is if services were closed due to COVID, we didn't call them either. Yes. Because you can appreciate the volume of calls that we had to make during the early stages of the pandemic. Just having a look through for any other questions.
Yeah, we're going to be sending out, thanks Lindsay, I think we're definitely, somebody's lost their sound, Kathleen McLeod. We will be sending out a link to the recording afterwards. The Care Inspector was carrying out a weekly survey that asked if your setting was at risk of closing and if you were open. I've not had a link in the Care Inspector email to this. Or is it no longer required to fill this in? I'm not quite sure what this person's talking about, but childminders don't require to fill in the weekly staff absence form. It wasn't available to them. Maybe that's what, there's a bit of confusion there. If the person wants to come back on, I'll see what I can do. I think we've answered the rules for taking our childminding little ones to indoor playgroups. Oh no, we didn't do indoor playgroups, did we not?
No, so there was previous guidance about organised activities, which is now archived by the Scottish Government because you can now go back to playgroups. So there's no restrictions there while we're beyond level 0, but you would obviously want to keep an eye on that should the levels change because they could be reintroduced.
So it's just general social distancing guidance and wearing masks and ventilation that would come into play there.
Yeah, and there's another question very similar. Are we allowed to return to toddler groups, libraries, soft play, etc.? So yeah, the answer to that is yes.
Again, there's another question there about masks. Hope we've answered that one. It's about social distancing. So what you say, childminders need to shut when someone in their household tests positive. So Anne answered that one in the first question, which is, so from what you're saying, childminders need to shut when someone in their household tests positive. Yes. However, mindies coming from a COVID positive household can attend a childminders, potentially causing them to shut down for all families they care for. Anne's answer to question 1 of the COVID was the Scottish Government based their decision on their updated understanding of transmission. Scientific data suggests that there's little evidence that the child will transmit the virus to adults, and that's what the Scottish Government has based this decision on.
Okay, there's another question here. Is there a list of symptoms for each variant, as there is so many out there, as some people testing positive only have a runny nose or sore head? So, sorry, Katrina, you want to answer that?
I think the Public Health Scotland has a good symptoms checklist on it. So we would really be referring you over to the Public Health Scotland advice there. Hand washing advice for under 3s.
I'm thinking that's a question, Katrina, that maybe people are looking for that when children are younger.
Okay, so we would just be encouraging effective hand washing for all babies and children of all ages and sizes. It's good to wash your hands.
And I think it's important here, Katrina, to mention as well that remembering the good practice that we had even before COVID. We were all very good at, after maybe nappy changing, washing your hands and washing the child's hands. So it's about remembering all that practice that you're already really good at.
Yeah.
There's another one. If you collect a child and drop off and parents don't drive, what happens when the child has symptoms and have to take home? Oh, that's a tricky one.
Well, that is a tricky one. I've lost my place now.
So that's anonymous at 6:35. If you collect a child and drop off and parents don't drive, what happens when the child has symptoms and you have to take home?
I don't know if this person just comes back on and puts a little link to who they are. We can maybe get back with a with an answer. Anyone else? We could pass it over to someone. Anyone else in our viewers gallery know what we would answer to that one? Jackie, are you there?
I'm thinking, Katrina, that would be part of your risk assessment. So what is the usual arrangements you have in place for that child to go home, and think about how you could reduce the risk? So if you were having to pop that child in the car and take them home, windows down, face coverings on, anything you can do. Obviously you can't take away all of the risks all of the time, but it's doing what you can in the situation that you're in. But if there's anything that we can add to that, I think Jackie's having trouble joining the conversation, but if she can add to that, then we'll certainly get back to you in our questions.
Here, Anne, here I'm listening. Yeah, I mean, that would be the basics of any sort of practice that we would suggest in relation to IPC. It's about keeping it real and realistic and working with the situation you're in. So yeah, it's about mitigating the risk, and there's a good, I'll put it in the chat, that the Scottish Government have pulled together around the ELC and the mitigation factors and what's changed from level 0 and beyond. So it might be in there how they presented it, but I would follow what you've said there, windows down, diagonal positions, and just basically what you've got, and obviously get the child, if it's above 5 and not tolerate a test, and get them tested. So, yeah.
Okay. Thanks, Jackie. There's another question. Is it acceptable for parents to look over the personal plans, and if there are no changes, then they sign a form to confirm this, rather than fill the whole form out again?
You want to take this
Do
on?
you want me to take that? Yeah. I would say absolutely, but again, you would be thinking about the age of the child as well. You know, so for some age groups, yes, 6 months, there may well not be any changes, but you know, for babies, then you would absolutely expect changes. But yes, as long as you have gone over that thoroughly with the parent, and you can absolutely see that there's no changes, and you're still working towards the same goals, then I don't see any reason why you would have to refill the whole form out again.
I completely agree. And any changes, and is it still the child in front of you that you're dealing with? Does it still show that person? Does it still show how you would look at the health, safety and welfare needs of that child in front of you?
Okay.
Can I just come in there as well?
Yes.
Just to contribute, you know, it's really important that if the child can share their views about their plan, you know, so even though the parent might be saying, yeah, no changes from our point of view, the child, you know, may well have some changes going on that they want to, you know, share with you or contribute that you then want to use to develop the plan alongside the child. So just a reminder that the child is key to personal planning, and their views should always be sought and should be demonstrated within their own personal plan.
Thanks, Lisa. So there's a number of comments with regards to the child who attends the service not requiring to self-isolate and household members having to close services. All we can say is we've given you the answer that is based on the Scottish Government decision, the Public Health Scotland decision. We have asked again with regards to it from the Care Inspectorate for update with regards to it from them. There may be updated guidance coming out, but at the minute they've based their decision on their updated understanding of transmission.
Okay, we have another question, Katrina. Have we still to wear a face shield if we suspect that a child has COVID? So I believe that is yes, it's still in the guidance that they should be wearing a face shield.
I would say that too.
Okay. Another one is, can you clarify if children need separate SAND resources or can they share these? Yes, they can share resources. Again, you would want to think about, though, you know, if you had an outbreak, you would be wanting to remove the sand and clean all your resources and just your usual daily cleaning routine.
And we bring water and Play-Doh. We can bring water and Play-Doh in there, and we would change them daily between groups and between if you have different children attending.
Okay, there's another comment about someone in the childminder's home having the virus. We need to close, but what if that person can self-isolate away from the areas that a childminder works in their home? Again, the guidance says if you have a positive case in your home, then they should not be coming to your setting. Okay. Right, someone is asking, hi, I'm a new childminder. Welcome, Karen. I started last week with a 6-month-old child 1 day a week. I'm using masks and asking parents to do so too. Wiping everything regularly, only visit the local park with wipes. Have I missed anything? Thank you, Karen. Karen, I think the guidance that we pointed or directed you to in the first instance, the Scottish Government guidance. If you read that, that will be a really good starter for 10, and the things that we've signposted you to throughout this session should keep you right. Your risk assessments, having them in place, it looks like you're thinking about things and you're putting the things in place, so you're already one step ahead. If you have any questions, feel free to pick up the phone to your inspector. They're there to support you.
I wonder if I could just come in again and just do a reminder about, you know, just as you've been saying about observing the COVID risk mitigations and some of the key points kind of that we would highlight in that, really staying vigilant to symptoms and responding quickly to those, and that would be part of your risk assessment, and that physical distancing from adults, ensuring that you're wearing face coverings if you can't physically distance, and just a reminder that we don't expect you to be physically distancing from children. You know, children need you to be close to them and to nurture them, you know, and it really is about supporting children through COVID and providing that high quality nurturing care that you all do so well. And just, you know, for children who, you know, are old enough to understand, just to support coughing etiquette as well within your setting, as well as hand hygiene, which has been talked about during this session as well. Hope that's helpful.
Thanks, Lisa.
Thanks, Lisa.
Can I just raise another question? Sorry, Katrina. Jackie, I wondered if I could raise it with you. Somebody has asked, in regards to getting the vaccine, will it be a requirement to have all vaccines? If so, will family members be required to have vaccines?
At the minute, it's not a requirement, because obviously there's people out there that for whatever reason maybe have medical reasons or underlying conditions that can't get the vaccine. If you've been watching what's been happening on the television, it's been actively encouraged that, you know, people are being pulled forward, and we're now at that range where we're also start to look at whether we vaccinate children or not, but it's not mandatory at the moment. I know from an adult point of view, there's some services who are making it mandatory for the staff to be vaccinated and have the 2 vaccinations, but at the minute, you know, we can't really sort of mandate for that, because there's many reasons why folk, one, may not wish it, or 2, have underlying conditions that exclude them from having it. So it's really a personal choice. And I don't think we'll ever get down that line of making it mandatory for everybody.
Okay, thanks, Jackie.
Thanks, Jackie. There is one more question. As we're allowed back to groups, can we have another childminder round in the house for a play date? And I would say yes. That's in line with the meeting indoors guidance, which would be 10 from 10 households indoors, isn't it, at the minute? So yes, you can have play dates in the childminder's house, but again, just go around, just take you back to, it's about staying safe, and just think about what you're comfortable with as we move our way out of this. We can't stress enough that the virus is still out there. Anne?
Yeah, I'm just looking just to check if we've answered all of the questions. There's a lot, it seems to be a lot of questions about the staff absence form.
Yes. And my understanding was that it was taken, Lisa or Karen, are you able to enlighten us a wee bit about that? No?
Yeah.
Oh yes,
so
here we go, Lisa.
Yeah. As you've said, childminders are not expected to complete the staff absences form.
It was called a childminding monitoring return. It was in the Care Inspectorate Weekly Bulletin, but is no longer there. We must have finished doing that if it's no longer in the weekly provider update.
Can I suggest that there seems to be obviously a wee bit of confusion, and maybe understandably so, in relation to a number of childminders have a number of staff. So maybe what we need to do is get clarity out after the session in relation to what childminders do require now and don't require to submit, because there's another question in there: should a childminder with a staff member complete the staff absence form? So I think there's enough confusion out there for us to clarify that later.
Okay, no problem. That sounds like a good idea.
Yeah. Thank you. We've got another question: are we allowed soft furnishings and soft dolls, etc., yet in our settings? Again, I think that is in the guidance. Yes, you can have that, but again, it's just while we're beyond level 0, just making sure you're following the instructions in terms of laundering them. And that can change as the levels go up in terms of how often you have to do that. So at the moment, it's just your normal, usual routine that you would use to clean them.
Anne, can I just ask if
yes,
the
of course
question in relation to the outbreaks can be answered? There's a question there with regards e-forms. Is an outbreak considered one child with symptoms, or is it 2 or more?
I'll need to check that, Katrina. I think
my understanding is that a notification requires to be submitted for each individual where there has been a positive case.
Yes.
So you need yeah, sorry, Katrina. So you would need a notification for each positive case. If it's a suspected case, then you can put more than one person into that. But if it's confirmed, then you would need one for each individual. Does that answer your question, Karen, or did you need?
I'm not sure. Maybe it was an anonymous question. If not, maybe the person can come back on and let us know.
Okay, and bear in mind we will look through these questions, and anything that we've missed, because they're coming in quite thick and fast, so we might have missed some. We will go through them and we will formulate a response and get them out to you after the webinar.
There is a section on our website as well about notifications. So if meantime, you know, if we're waiting for us to get the information out to the, replying to questions, you may wish to go to our website and have a look at the notifications section there, just to refresh yourselves about requirements for notifications.
Okay, thank you. There's another question about taking children on public transport. Can we do this? Yes, you can. That's the short answer to that. Can parents now come into the house for drop-off, pick-up, or still better to have doorstep / garden pick-up? Again, yes, that can be carried out. Sorry, I'm trying to answer as many questions as we can here, so the answers are getting brief.
Can parents now come into the house for drop off or pick up? It's still better to do doorstep garden pick up.
Yes, so there's a few questions, Katrina, now coming in about can parents come into the house?
Yes. So the answer, the short answer is no. It's best to still do it at the door, but there is a lot of information on the guidance with regards to people accessing your service. It should be done with physical distancing in place. It should take in place. Should take in mind of the ventilation. It should be pre-booked, so you should try and make sure that not 2 people are coming in at once. Children and adults should remain distanced. If your virtual world is working well, we are really saying to you, keep going with it. We know that we've had some very, very good examples of the virtual means that you've put in place, that a lot of childminders have in place, that's working well. The virus is still out there.
I think we've covered most of the questions now, Katrina.
I think so. I will just go back and say, yes, I'd like to just a big thank you to Stephen for being uber efficient and keeping us right tonight. And can we have the last slide, please, Stephen? We hope this has helped you to keep working in a COVID-19 safe way, and as we enjoy more normality and freedom in our lives, that you all keep safe, and thanks very much for joining us.
Thank you.
Thank you.